Hello and welcome to Group 5's presentation about the COVID-19 crisis at the Farmville Detention Center. In this presentation, we will explore how the coronavirus pandemic is uniquely impacting an immigration detention center in Central Virginia and why this health and humanitarian crisis is a social justice issue. The COVID-19 pandemic has overwhelmed the U.S. healthcare system, claiming the lives of over 120,000 people. COVID-19 has proven particularly dangerous once introduced to jails, prisons, and ICE detention centers because the conditions of close confinement, inability or reluctance to isolate infected people, and lack of access to adequate medical care exacerbate the spread of the deadly virus. Across the nation, at least 64,119 incarcerated people have tested positive for coronavirus as of mid-July, with almost 700 dying as a result of the virus. This month, a crisis has emerged locally in one Virginia facility. Farmville Detention Center is a private facility owned by the Immigration Centers of America, a corporation run by a small group of Virginia-based investors. At the beginning of June, during the coronavirus global pandemic, Farmville Detention Center accepted a transfer of 74 people from ICE facilities in Arizona and Florida, current COVID-19 hotspots, to mitigate overcrowding in other facilities. 74 individuals were not isolated while at Caroline Detention Center, the first Virginia facility they were moved to. Farmville officials claim that the transferred individuals did not join the general population when they first arrived at Farmville. At the end of May, there were no positive COVID-19 cases at Farmville Detention Center. In the first week of June, 51 of the 74 transferred people tested positive for COVID-19 during their pre-screening. Over a month later, 90% of the total Farmville Detention Center population has tested positive for COVID-19. The Farmville Detention Center COVID-19 crisis presents an opportunity to examine this health and humanitarian emergency through a social justice lens. The crisis demonstrates the unique ways historically marginalized communities are disenfranchised during the pandemic and the relevance of the social determinants of health in the time of COVID-19. The events at Farmville also exposes how the cycle of oppression and the myth of scarcity facilitate systemic targeting of undocumented people and the institutional negligence that is jeopardizing the lives of people detained in the center. Lastly, this situation allows social work practitioners to think through how NASW values of service, social justice, dignity and worth of a person, and importance of human relationships necessitate an intervention. The United States has long defined itself by the identities of people to whom it confers citizenship status, legally and socially. The terrorist attacks of September 11th sparked the creation of the Department of Homeland Security, with Immigration and Customs Enforcement, or ICE, operating as one of its major components. Xenophobia, or the aversion to people from other countries, largely influences the legal and socio-cultural impact of ICE, given that the heightened US surveillance response to non-citizens in the early 2000s inspired its function. The cycle of oppression shows how inaccurate beliefs about a targeted group justify violence towards and oppression of that group, like stereotypes about immigrants being lazy, greedy, or dangerous. Over time, misinformation about and mistreatment of the targeted group become increasingly socially acceptable, solidifying the harmful ideology and even encouraging individuals and institutions to carry out violence that seeks to control or eliminate the targeted group. Since Trump's inauguration, racist ideology about immigrants of color has increased legal statutes that promote ICE raids and even illegal circumstances around detention. This climate of xenophobia has even emboldened US residents to attack and harm immigrants in their own communities.
Prevalent myths have emerged that relate to our topic when talking about society's views of immigrants and the policing of our borders. One of those is the myth of scarcity. Here in the late 1990s, Suzanne Farr explored this term in relation to immigration and explained it as the myth which reinforces the belief that there is not enough to go around. The messages communicated by the myth of scarcity are: there's not enough money, not enough good jobs, not enough quality education, not enough good health care, just not enough to go around. A recent New York Times article here describes it also as the lump of labor fallacy, the incorrect idea that there is only so much work to be done and that no one can get a job without taking one from someone else. Here, the recent 2016 Chamber of Commerce report on immigration myths and facts also shared a common myth that jobs filled by immigrants are jobs that could be filled by unemployed citizens. On the contrary, they share the fact that immigrants typically do not compete for jobs with native-born workers, rather they create jobs as entrepreneurs, consumers, and taxpayers. Here, the Scene on Radio broadcast we listened to in this module raises a similar point when they share about the racial cleansing or expulsion of Black people in the town of Corbin, Kentucky. Much like the belief communicated about immigrants, white people at that time framed this expulsion as not being about race, but about shifting work to a new. When discussing the COVID crisis at Farmville, our group felt it was important to take a closer look at the social determinants of health. Social determinants of health describe that where we live, learn, work, and play contribute to our health. These conditions over time lead to different levels of health risks, needs, and outcomes among groups of people. Longstanding systemic health and social inequalities have put many members of racial and ethnic minority groups at increased risk of getting COVID-19, regardless of age. Here, detainees have shared that the risk of the coronavirus spreading further is even more severe than what's being reported. Here, they share an environment where many people are sick, unable to isolate, and denied proper medical care. Here, a rise in COVID cases within detention facilities reported across the country have revealed that this crisis has largely been due to a failure to quickly isolate symptomatic people inside the facility. And here, though their website shares that Farmville is considered the role model and trendsetter for providing safe, humane, and secure conditions. One young man, for example, described an incident in which guards used pepper spray on detainees who did not stand up to be counted. The young man says they were unable to stand because as a group, we also felt there were several social work values this issue relates to. Service, as it relates to those reaching out on behalf of those detained. Social justice, as this speaks to an issue impacted by social, political, and economic systems perpetuating the problem, and advocating on behalf of vulnerable and oppressed individuals. Dignity and worth of a person, as it's evident that many are fighting to ensure that detainees receive the same level of care that all individuals would receive in this country. And then importance of human relationships, consideration for families, and hearing the voices of those who are concerned for their loved ones. And here you'll see some examples of some of those voices of those impacted, as well as advocating on behalf of those individuals at Farmville. They speak about safety, they speak about adequate treatment, they speak about the fear they have about what's happening there. They also speak about immigration detention not being a death sentence. And on the next slide, we want to show you a closer look at what life is like at Farmville.
But now, nearly 90% of the facility, 315 people, are infected with the virus. And this detainee says the medical care is poor.
They ask them for pills, and they won't even give them Tylenol.
And he says, forget social distancing. Their bunk beds are practically on top of each other.
The way we sleep here, he's probably 5 inches, 7 inches away from me. This is ridiculous. This is not right. I mean, help us.
So who are the allies? One of our articles to read in this module discusses how often those who are actively being oppressed need allies to advocate for them. These allies are often groups or individuals who are in a dominant group of society who not only advocate but become mediators to understand how this oppression is taking place. In this case, the Capital Area Immigrants' Rights Coalition, or CARE, is the primary ally to the detainees. CARE tried to speak with both ICE and the Farmville Detention Center, but had no luck, and are now taking legal action to demand ICE release the detainees from this location. Also, Virginia Senators Warner and Kane spoke out about this, and you can click the link there, which is a letter that they wrote to ICE requesting answers of their handling of the situation. So our group's thoughts on the issue are that this connects to our current module discussing the cycle of oppression, because it is a good example of power and how those who do not have it are often controlled by those who have the power, who do have power. In this case, the ICE detainees have no autonomy over their health or well-being, which also makes this a human rights issue. This issue is especially angering because of the irony of ICE detaining immigrants because they didn't follow the protocol to get the documents to live here, but then ICE themselves are not following the protocol to keep the detainees safe from COVID. So we see this as a blatant hypocrisy where those who have power are often not held accountable for their actions and the mistakes that they make. As social workers, we support challenging the social injustice and enacting worth and the dignity of the person by advocating with those who are impacted by the immigration system and becoming allies to inform the public of this issue. So although our group, we definitely think that this is a social a justice and human rights issue, we can see some historical responses in America to immigrants kind of ingrained in our society that would make someone maybe not agree. Nativism and racism is a mindset that has been in our country since the beginning. This kind of thinking of who belongs here. If you're not white, then you don't belong here. And staying here will eventually ruin our white institutions. Also, because this is a legal issue of immigrants being undocumented, racism is justified through the legalism of this issue. So because you don't have the documents is why we don't want you here. And it's kind of finding the reason to be racist without having to say it. We saw this a lot after 9/11 towards Muslim Americans because we were afraid for our safety at that time. With the COVID situation, it becomes even more of a reason because you're not just here without the documents that you need, but you're also a risk to our health now. So racism can hide behind either one with this issue. And lastly, our current administration's rhetoric on the coronavirus continues to link the problem to those outside the US by avoiding the blame in the media and linking this to those outside the US. It creates an atmosphere where nativism and xenophobia are supported by those in power. So what do you think? Our questions for the class are, what is the long-term impact of companies and institutions profiting from the criminalization of immigrants? Number two, in what ways can social workers serve to address this crisis in ICE detention centers such as the one in Farmville, Virginia? And lastly, other than human rights, do you feel undocumented immigrants should have the same rights as a citizen of the United States? And explain why or why not. Thank you.